welcome to the NK Active virtual tour. I thought it would be a nice idea just to give us a brief introduction about the people involved from the clinical side here at NK Active. So as I am sat in the middle, I will go first. My name is Nick Knight. I am a podiatrist, trained in Northampton, then completed my MSc in Brighton. My role in the clinic is sort of split. I am a clinician working 2.5, 3 days a week, depending on which week it is. And then my other time, I then sort of clinical director working on the business, as it were. I tend to have, well, by mistake, developed a passion for things like plantar plate injuries. But my biggest passion is mainly around sort of the 3D gait analysis and the rehab side of things. And I sort of graduated, works in the private sector in London for a year. Essentially, that was there just to try and help get enough money to buy a house. Then I moved to the NHS and spent, I think it was about 5-6 years in the NHS, and then got to a point where I said, okay, I think I just need to push myself further, and was very fortunate enough to be selected. I don't know how I got the gig, but to be part of the podiatric medical team at the London 2012 Paralympic Games. And that's where I met a podiatric surgeon who's become a mentor and a very good friend, Trevor Pryor. And I remember I was at a wedding one day and Trevor phoned me and said, Nick, do you want a job? Come work for me. So I did. That's when I sort of then left the NHS. And then as time developed, got to a point where I think, okay, I just need our own clinic. So then that's when I sort of opened NK Active in September 2019 and brought all the team under one roof. And we have the 3D gate on site. We have 3 clinic rooms. We sort of have one gym where all the strength stuff is. Then we have the 3rd clinic room upstairs is also then doubled up as a second gym area as well. So we're really passionate on taking people through that whole journey from injury back to whatever activity they want to do, whether that be reducing their risk of falls, whether that be trying to make the world championships, whether that is just be going for a walk with the family. It doesn't matter. As long as they want to move forward or get active and stay active, then we're here to help. So we also then have David, our exercise rehabilitator, and I shall let him introduce himself and tell him about his journey and how he got to us at NK Active.
Hi there, my name's Dave Rigg. My thing's exercise. I like exercise. I think the evidence behind it for treating musculoskeletal conditions, long-term conditions, mental health conditions, makes it one of the simplest but underused and often misunderstood treatments that we have. I started off in the military, running around, and had a good background in doing a lot of exercise. I then got injured and worked at Headley Court and saw a lot of complex trauma and blast injuries. I worked in the NHS and in occupational health in private settings. So I've had quite a wide experience of exercise, from rehabilitation, treatment, return to work, mild to moderate depression, anxiety. Exercise is just, I think, the way ahead for a lot of conditions.
Yep, that's a good job. That's why he works here, because if he wasn't keen on exercise, then he's in the wrong clinic. And lastly, I think you all know Charlie, but I shall let her introduce herself in case any of you don't.
Thanks. So Charlie, or if you're seeing me at the university, you may know me as Dr. Dando. So I'm a podiatrist by background, and then you see me in some of your lecture sessions, as well as researching, and then also a clinician as well. So this is me giving you a little bit of insight into my world and what it's like if you were to choose to live a academic blended with practice. So I first started off doing my PhD alongside working in the NHS, loved every minute of it, and then kind of got to a bug where I wanted to learn just a little bit more and I wanted to do something different, and came across Nick. Nick was working, looking at building up his business and where he was going forward, and luckily I was able to offer a job and a place here, and so I've been very happy here, blending academia, research and practice together as one.
Yeah, no, and I think that has been the key, has been building that right team for us here and having that blend between David's experience about working in a variety of settings and then with the exercise knowledge, because as podiatrist, all my rehab training has been sort of postgrad, whereas David's training has been that what his training has been. And then Charlie's then opened our eyes up to bringing research and clinical audit into the private setting, just to prove that you can do it. You can run research out of a private clinic. You can do clinical audit. So that is a brief introduction to the team. Enjoy the tour, and if you have any questions, just let me know, and we shall see you all soon. See you later.